Experts have issued a severe warning about a new and concerning global healthcare risk related to COVID-19, stating that it could start a heart failure pandemic. The rise in COVID-19 cases, especially due to the new strain known as JN.1, could lead to potential heart issues, a new study by Japanese scientists has revealed. Following a spike in COVID cases in several countries, including the US, UK, China, and India, in recent weeks, largely due to the influx of a new strain JN.1. Health experts have warned that this will increase the chances of potential heart issues for those who catch the disease. Scientists from Japan's top research institute, RIKEN, issued the warning in a new report. They say the ACE2 receptors, which the coronavirus clings to within human cells, are very common in the heart. This means many people who catch the virus may suffer from reduced cardiac function. The reason for this is still unclear. However, the report suggests the COVID pandemic might have changed things significantly. It warns that the number of those at risk of future heart failure due to persistent infection of SARS-CoV-2 is expected to exponentially increase. The report states, even though conclusive clinical evidence that persistent SARS-CoV-2 infection is associated with declined cardiac function has not been reported so far, the proof-of-concept study of the possibility of SARS-CoV-2, persistent infection of the heart, and the potential risk of opportunistic progression of heart failure should be validated by a three-dimensional human cardiac tissue model, which would serve as the alarm bell for a global healthcare risk. The latest warning comes with a sharp increase in COVID cases in several countries, including the US, as millions of people prepare to travel for the holiday season, with the fast-spreading JN.1 variant making up 44% of all cases nationwide. Health officials have warned that combined with a rising number of flu cases, this winter may see a significant increase in illness cases, especially ahead of crowded social events for New Year's celebrations. Meanwhile, according to a study, the COVID-19 virus can persist in the blood and tissue of the infected patients for more than a year after the acute phase of the disease has ended. The research presented at the Conference on Retroviruses and Opportunistic Infections in Colorado, U.S. offers potential clues. Colorado, ES offers potential clues to why some people develop long COVID-19, a condition in which the symptoms linger for months. The researchers from the University of California, San Francisco, found pieces of SARS-CoV-2, referred to as COVID antigens, lingering in the blood up to 14 months after infection, and for over 2 years, in tissue samples from people who had COVID-19.